Almost a third of adult Australians say they're not likely to be vaccinated against COVID-19, according to a survey commissioned by the Sydney Morning Herald and The Age. Professor Julie Leask is a vaccine uptake specialist from the University of Sydney, and she joins us now. Julie, welcome. So to me, this seemed like a pretty shocking figure, but does it tie in with what we've seen in previous surveys or not?
Slightly. I think if you do some of the maths and compare it to previous surveys, there is a little bit of reduced intention to have the COVID-19 vaccine at the moment. But we expect that as people have their questions answered and their hesitancy addressed, that will start to resolve itself.
Why is that your theory? Because you say there's been a slight increase in the hesitancy. Why do you think that's going to turn around?
Because if you look at the actual things that people are saying and how hesitant they are, it's indicating that there are questions that people just have yet to resolve. Some people even think that because the vaccine won't be available for them just yet, they're waiting for that. So that will also factor into their hesitancy. And there are some people who are just a bit confused about where and how they get the vaccine and they're waiting. So we think that when people are on the fence like that, if you give them good information, address their questions, and also show others vaccinating, that can resolve some of that hesitancy.
And what about the structure of this? Is this a fair reflection of what the attitudes are in the general population?
Yeah, so this survey interestingly had 4% who are against vaccines in general, but of course a lot more people who were saying they weren't planning to have the COVID-19 vaccine. So here you've got hesitancy about this new vaccine that people feel less familiar with, but also that hardcore of people who will always be opposed to vaccination, who are a small but sometimes quite vocal group.
And is it the case that this was only people who haven't had their vaccine yet, so this excluded that proportion of the population?
That's right. So you've got to look carefully at that data. It's not quite a third of Australians not planning to have it. It's a third of the proportion who have not had one or registered for one yet. So it's actually smaller than the data suggest.
So when it comes to the end of this vaccination rollout, what's your prediction based on where we're at now about how that percentage of Australians who will have actually taken it up?
Right now we've got a situation where demand outstrips supply. So we've got all those people fronting up to the hubs, to their GP, who want the vaccine. And as we go and we get more and more of those people vaccinated, we'll start to see a plateauing of our vaccination uptake, as they've seen in Israel and the UK, where you're starting to have to reach those more hesitant people. We'll need different strategies with those people. We should start working on that right now, though.
And I'll get to that in a moment, but I'm keen on getting a figure from you if you want to. Do you think in the end 90% of adult Australians who it's urged will get the vaccine will get it, or will it be that high or a bit lower? What do you think?
I honestly don't think that's going to be the case. Just by looking at existing vaccination rates for adults in Australia, we've always struggled with getting people to have that yearly flu vaccine when they're recommended to have it.
But hasn't Australia got a pretty good reputation in injection uptake?
We do for childhood vaccines. So we've got 95% of 5-year-olds fully vaccinated. But adults are a little bit more hesitant in general. Put on top of that this new vaccine where there are risk issues, albeit very small, but things that people are concerned about, and where you've got that suspicion of any new technology. So I think we can overcome it. We've seen that in the past with new vaccine programs where a lot of that hesitancy can be resolved. But I think 90% for adults is very ambitious. I hope we get there. We need to.
Yeah.
But
so more realistic would be about 80, you think?
That would be great to see. I'd be very happy to see that, but it could be as low as 60. It's very hard to predict these things, though, because, we shouldn't underestimate the motivation people have to have protection from COVID-19, given its unique impact on us, not like the yearly flu that people tend to underestimate.
So you think that possibly only 60% of Australian adults will decide to get the vaccination?
And in the initial stage, yes, because in Israel, for example, you've got about 60% who have had the vaccine, and that rate is now starting to flatten out. Right. So I think, look, that, you know, Israel will do better because it's got some pretty strong sort of carrots and sticks in there to get people vaccinated. But we'll need to have a comprehensive national strategy.
Yeah. And so is that missing now?
Yes.
Yeah.
We don't have a national strategy.
A communication strategy you're talking about?
No, because communication alone won't get people vaccinated, because they need to also be able to access vaccines easily and have convenient services. So it's a really important part of it, but it's not the only solution.
Right, so when you say a national strategy is missing at the moment, what are the components to that national strategy that's missing?
Multi-layered. We have policies, we have work with institutions, primary care providers, maybe even incentives for providers to recommend and give vaccines for their patients. We need to have some incentives for people to be vaccinated. You're seeing some strategies in the US, for example, with people going into a lottery. All sorts of things that we know from behavioural science improve vaccination rates. And it's not just communication, although that is important too.
Yeah. And so are you surprised that this hasn't been formulated already?
No, because they've just been scrambling to get the vaccine, the supply, to get the systems ramped up. This is a unique program. It's been incredibly challenging, as we all know. But I think that now is the time for the government to start looking at that and being proactive in its planning about how we're going to get those high vaccination rates.
Yeah. And what sort of kind of national advertising, this is just one component of it, as you say, but what kind of national advertising strategy would you like to see?
We've seen some fabulous examples from Singapore, from the UK, a lot of humour. From New Zealand, we've seen a lot of Maori people in their campaign, very culturally respectful and conversant, well-researched. So we need that big broadcast campaign to get people motivated. Now we're starting to sort our supply issues, but we'll also need that one-to-one or community-based communication, and we'll need to have community leaders and people working in local public health enabled to do that, and it's a little bit constrained right now.